You know, one big role that I had when I was with physio was to do chart reviews. And I did a lot of chart reviews. And when you have 75 clinics that you do chart reviews for, one of the things that you tend to see are trends among therapists. And one of the trends that you tend to see among therapists is maintenance. Everybody understand that, right? And Medicare doesn't pay for maintenance, right? We know that. But what maintenance becomes, or the reason that maintenance happens, is because sometimes I think we get busy and we don't look at exercise progressions and exercise programs maybe with the light that we already have and that we could look at. And so what I'm going to tend to do is go over some of the concepts behind exercise progression, but also add to that a different level, okay? And add to it a intensity level. Because the other thing that we see in therapy in general is as a industry-wide, okay, is that we tend to be much more conservative with patients than they could probably tolerate. And part of that comes from our rehabilitation background, okay? Because we don't want to push the window because of the fear for pathology, right? On the other end of the spectrum, we have other professions who are training people really, really hard, right? And maybe not considering some of these pathology things, right? We also have some professions right in the middle. Professions right in the middle who are considering these training perspectives and considering these rehab perspectives and pushing people to that level where they can go safely based on the science, based on the knowledge of the pathology, and getting great results. Does anybody know who that is? The athletic training profession is making big strides in reimbursement. Did you know that? From a legislative standpoint, and they are positioning themselves to be the kind of the paid for that gap right there that I just described to you. Okay, and we all, I think athletic trainers as well. Okay, but I think we all also possess that knowledge. And how do we take from here to go to here and do that safely? We all have the knowledge to do that, but I think sometimes we are hesitant to do that, okay? So what I'm going to present to you are some topics and just concepts related to exercise and how do we know when it's okay to take the person to the next step. What I always tell people is that, you know, I will typically take people 1 or 2 steps beyond where I think they can achieve and see if they can achieve it, and if they can't, I step it back. Because what I tend to find is that people will achieve that, or I step it back 1 step, which is still beyond where I would have been initially. Does that make sense? And the thing that you see with that, and what the studies show with that, is that outcomes are better. The episode of care is shrunk down, and the outcome is improved, okay? So as a profession, we are being guided by our outcomes. Did you know that? I think I mentioned that last time, right? Okay, and it is fast approaching, folks. Very fast approaching. I met with the clinical prediction model committee chair at the combined sections meeting, and some of the things coming down the pike for our profession are going to hold our profession much more accountable than we've been held accountable to before. And one of the pieces that we're going to be held accountable to is the ability to produce outcomes in a shorter episode of care. Because if you look at the research and you look at the longevity of the research, that episode of care could probably be a little bit shorter and have a better outcome. But what happens, I think, is that we get busy, right? We all get busy, and we forget to look at the exercise program Mrs. Jones has done, and maybe we haven't progressed it. So how do we progress it? How do we take these concepts and integrate them into our rehabilitation protocols to make it push to the next level, okay?